Secretary Blinken, thank you very much. To everyone who's been part of this effort, I congratulate all of us for this effort and everyone who's going to be working with us on this. At HHS, we continue to implement the ambitious plans of the National Action Plan overall. We are bringing our full weight to strengthen the health and well-being of individuals, families, and communities impacted by human trafficking. Today, I'm announcing the establishment of the HHS Task Force to Prevent Human Trafficking, which will increase our coordination and collaboration across our various agencies in the department. The task force will scale prevention, it will expand access to services, and it will build scientific understanding. On prevention, we will release the department's first Human Trafficking Prevention Action Plan, incorporating lessons learned from the implementation of the Human Trafficking Prevention Education Demonstration Program. We'll incorporate gender and racial equity principles in the development of new public awareness and outreach strategies to better reach and reflect the diverse communities experiencing human trafficking. We will establish a technical working group to prevent forced labor in healthcare supply chains, to hold industry listening sessions to prevent human trafficking in direct care services such as child care and elder care, and we will publish information resources. On access, we will publish several funding opportunities with a strengthened equity-focused program design, including new grant awards focused on gaps in services for survivors of labor trafficking, child trafficking, and those in the Pacific region. We will coordinate with state, federal, and non-governmental organizations to further strengthen support for unaccompanied children at risk of human trafficking, and we will implement regional initiatives to increase access to key gaps in services, particularly substance use and mental health, housing, and economic mobility services. On building scientific understanding, we will release a supplemental issue of the Surgeon General's public health reports on what we have learned after 20 years of public health progress on human trafficking. We will issue a call for papers on the impact of COVID-19 on human trafficking and intersecting forms of violence, and implement research on demand and other underlying factors of human trafficking. And we will identify opportunities to open more data on human trafficking from relevant HHS programs, and will continue to modernize HHS's system for collecting data on human trafficking. We do all of this hoping to add to this opportunity to really tackle this issue of human trafficking. So in closing, we look forward to working with our federal and external partners to respond to human trafficking through a preventative approach that promotes innovation and advances equity in reducing structural barriers. Thank you.